Global healthcare today is dependent on transnational linkages of medical coding systems that allow patient information to cross borders seamlessly and timely. Medical coding systems such as ICD, CPT, and SNOMED prove that globalization in healthcare can be vital to good patient outcomes and even life-saving. ICD is adopted in over 35 countries. CPT, even though it's US based, is licensed in more than 60 countries. SNOMED is used in 80 plus countries, covering 1/3 of the world's population. These systems began locally. ICD began in France, CPT in the US, SNOMED through a US UK collaboration. But today they are growing and functioning as a global infrastructure to help patients' health. The NGO, World Health Organization, and SNOMED International are actively linking ICD and SNOMED codes to prove and provide international bridges for patients to achieve better health care worldwide. Consider a scenario where two travelers from America travel abroad. One travels to Mongolia. Mongolia has not integrated the SNOMED coding system. If this patient were to become ill and be unconscious or be in a car wreck, doctors could not access any prior records electronically. Their medical allergies, list of medications, current labs, current blood works, or any x-rays or ultrasounds could not be obtained. They would have a blank chart. Now consider the second traveler, American traveler, who went to Norway, where the SNOMED coding system is integrated and doctors can instantly retrieve the patient's medical history. They do know the current lab work and blood work and x-rays and the patient's allergies and medication allergies and list of current medications. Treatment is safe, efficient, and informed, even if the patient is unconscious. This contrast demonstrates why contemporary global interdependencies for patient safety is important and depends on nations adopting interoperable coding systems. Recent studies have confirmed that these linkages between systems are getting more standardized. One study by the Journal of American Medicine found that 59% of ICD coding entries match SNOMED coding entries, proving that interoperability is an achievable goal and needs to be continued. Another BBC Black Book rankings show Estonia, Finland, and Denmark achieved 98% interoperability rates, setting global benchmarks. And a Harris poll revealed 96% of physicians agree that easier access from interoperable data between countries saves patient lives. These statistics prove that coding systems are not just technical, they are transnational and important in shaping patient outcomes worldwide. In conclusion, ICD, CPT, and SNOMED coding systems are more than just classifications of diagnoses and procedure codes. They are global linkages that connect hospitals in Oslo to clinics in Toronto, researchers in Tokyo to policymakers in Nairobi, and patients in Santiago to specialists in London. These transnational linkages exist, and they are transforming healthcare today, and they are very important for us to continue to grow. Globalization in healthcare means that no matter where you are, your medical story can be understood.